This video is about pain in your dog. What does it look like? What does it mean? And how to manage it. So let's rip the band-aid off. A quick disclaimer. I'm not a veterinary professional or a medical professional of any kind. I have worked in kennels and I have basic qualifications in animal care. I also have over 30 years experience with my own dogs. If you have any concerns whatsoever, then please do consult a veterinary professional who can aid you in a much more informed way. Research suggests that pain is responsible for up to 80% of reported behavioural problems in dogs. Now let that sink in, that's a really significant number of dogs whose life is being affected by pain. If the dog is suffering, no amount of training is going to help to improve its behaviour, because its behaviour is a result of the pain itself. So unless that pain is dealt with, the dog is always going to be unable to improve its behaviour through training alone. If you're in pain and it affects your behaviour in the ways that pain and fear typically affect your behaviour, and then someone comes along and starts placing demands on you, or even worse, becomes angry at you for expressing that pain or fear, that's not going to make you feel better or more compliant. And our dogs are just the same, except for one vital difference. They're completely unable to tell us what's wrong. And recognising pain in dogs is not always as straightforward as you would imagine. But even if the dog doesn't appear to be in pain, that's not necessarily the case. Just because your dog's charging around and playing does not mean that they're not in pain. Dogs are really, really good at masking pain. They're also highly driven to pursue the things that they enjoy, regardless of pain. And when it comes to things like physical exercise, often the pain doesn't occur at the time of exercise, but flares up afterwards. So the dog never makes an association between that activity and the pain that follows. For a long time, we didn't understand that Colby was suffering from luxating patella because he absolutely loved to charge around with other dogs and climb on boulders and do all the things he loves to do. That's just because he really, really wanted to do them. So we often expect to see limping, crying, yelping, a reluctance to exercise, stiffness, but that's not always what we see in dogs, although it can be. Pain can be caused by many, many really common ailments. So it could be anal gland issues, joint issues, chipped or bad tooth, allergies. It could be gut issues, ear infections, or a myriad of other common ailments that aren't always immediately obvious. So apart from the obvious signs of pain that we've already discussed, others can be zoomies. If your dog gets zoomies frequently, it's not necessarily a sign of pain, but it can be a sign of pain. Stress and a build-up of tension in the body, that's where the zoomies kick in. It's a throwing off of that build-up of nervous energy caused by the pain. Dogs might chew themselves or lick themselves, not even necessarily in the place that they're experiencing the pain. And we see this with anal glands a lot. The pain obviously is located to the anal gland area, but the dog could be chewing its feet or its legs or any other area of its body. An increased reactivity to other dogs or other stimulus, an increase in fear. Scooting for anal gland issues. Difficulty eating or chewing could show a problem with the teeth. A loss of appetite, upset tummy symptoms, restlessness, sleeping more, increase in barking, separation anxiety could appear or get worse, resource guarding. That can be an indication of pain. It can also be an indication of nutritional deficiency. If a dog is missing various nutrients in its body, then the dog's system communicates in some way to the dog, you need to guard this resource because you are short of it. And noise reactivity, something else that I've observed in Colby when his pain is stronger. Pulling on the lead could also be an indication of pain, especially if the harness or collar is adding to the dog's discomfort in some way. If your dog's exhibiting any of these behaviours, it's not necessarily a reason to panic. Just because they can be indicators of pain doesn't necessarily mean that they are indicators of pain. Having said that, if you are concerned about your dog in any way, then please seek the help of a veterinary professional and advocate for your dog. It's your responsibility, so please don't hesitate. You are not wasting the vet's time. You should ask them to check your dog's teeth, ears, eyes, skin, joints, anal glands and nails, because a broken nail can be a subtle but painful thing to go wrong with your dog. Ideally, they should also be taking stool and urine samples, as well as blood samples to check for parasites, nutritional deficiencies, etc. Colby was quite noise reactive in the house when we first adopted him, and he could also be a little reactive on walks. I just chalked it up to his temperament. But after a little while, I started noticing an odd little hop, skip and a jump in his back leg. Because I'd been on breed-specific forums talking about poodles and poodle bichon crosses, I recognised could be a symptom of luxating patella. I made him a vet's appointment, and with an examination, the vet was able to see that he did indeed have luxating patella in both his back knees, though one was worse than the other. So luxating patella is basically where the groove in the knee is not deep enough. So the kneecap can pop out of place, and then the little hop, skip and a jump is the dog popping it back in place again. And this was causing him some pain and discomfort. The vet put Colby on a course of anti-inflammatory painkillers, as well as referring him to a veterinary physiotherapist. Very quickly after receiving the painkillers, I noticed that his reactivity decreased markedly, and he was a lot happier in himself, less spooky towards things we encountered on walks or noises that occurred at home. If I hadn't recognised that hop, skip and a jump, I would never have known that he was in any pain whatsoever. While under the care of our wonderful physio, she would often observe pain not just in his knee, but in other parts of his body, such as along his back, which is why he hated wearing a harness at that time. His knee was affecting his gait and the way he walked, which was again having an impact on other muscle groups and joints in his body. She was able to give him massage and red light therapy, which really helped to soothe him. And although he didn't have to be on painkillers all the time, by observing his behaviour, I could tell when he was having a flare-up and give them to him as and when needed to keep him much more comfortable. There was even a couple of occasions where his body was too painful for him even to want to be touched by the physio. That came as a surprise because at no time was he whining or reducing his activity or licking himself or behaving in those ways that we would expect. And yet he was clearly and obviously in pain. With a lot of hard work and persistence and exercises, Colby's now been discharged from the physio, and he very rarely hops, skips or jumps anymore. But although his knee is now much better, I have noticed similar reactions when he's had issues with his anal glands and a quick trip to the vet, and we've been able to sort that out, and his behaviour has recovered back to what it should be very swiftly. So don't be afraid to ask your vet to check all those areas that we've discussed. Vets are very busy people and are sometimes reluctant to do as much as you're asking them to do. But if you're concerned for your dog, you really need to advocate them. They can't do it for themselves. Don't be afraid to ask for a second opinion. You're not obligated to stick with a vet just because you signed up with them. If there's another vet in your area, go and see them, ask them, and see what they say. I moved vets with Colby a couple of times because I registered him with my nearest vet where my last dog had gone to. But it's not until you actually need to access that vet that you find out how good they are at providing services. We had a fairly urgent situation and the vet that I was with were not able to provide the care that he needed. I understand the challenges that veterinary surgery were facing, but why would I choose to send my dog to a vet without the resources to treat him, when nearby there is another vet that did have the resources and the inclination to treat him? So I actually moved him twice before I settled on the vet that we're with now, and I've been really happy with them. You can also ask for a thing called a pain trial, where if there's not anything obviously wrong with your dog, your vet can put your dog on a course of painkillers and see if the dog's behaviour changes. If it does, then that's a good indication that pain is causing your dog's difficulties, and more investigation can be done from there. What health challenges has your dog overcome? Let me know in the comments.